This is ABC 7 News.
It's one of the most common cancers among men.
Yeah, and new guidelines have recently been issued. What you need to know about them next. Right, we are wrapping up National Men's Health Month, June, and this is certainly a good reminder to get screened for prostate cancer, which is something that a lot of men deal with. Experts say there will be 168,000 new cases this year. And joining us is Dr. Patrick Bennett, who is a urologist with Marin General. We're delighted to have you here, Dr. Bennett. Thanks for coming.
Pleasure to be here.
What men should get screened and at what age?
Well, this is an evolving topic. There was a sense that with the advent of PSA 30 years ago, everyone should get screened. But we now have a sense that a better understanding of who's really at risk. And my organization, the American Urologic Association, recommends shared decision-making discussions with your doctor starting at age 55 through 69. The idea being that that's the age range in men who have more than 10 years of life expectancy. They're going to likely benefit from detecting high-risk cancer.
And is it still PSA, or there's a little bit of controversy about the PSA test, I know.
The PSA, applied carefully, discussed with patients, and interpreted carefully can be very helpful. That, along with the digital rectal examination, remain the most powerful ways of initial screening. What's changed most, really, in the last few years is the availability of other tests to follow up the PSA and to follow up the DRE to really figure out who needs further testing, such as a biopsy.
I see, to really pin it down. So,
right. Exactly.
What are the current treatments? Have they changed much in the last few years? Have they gotten better? I know there were some side effects that we were aware of.
Sure. And I think that the treatments that have really risen to the fore in the last decade are the robotic radical prostatectomy and radiation therapy. And there are nuanced variations on each of those. But what we're finding more and more is that centers of excellence concentrate these cases in the hands of surgeons and radiation oncologists who treat large numbers very successfully. The actual treatments are really recommended for those specific patients whose tumors appear to be at the highest risk.
I see.
And the treatments, aided by MRI, aided by genomics, aided by many new technologies, are better and safer and more effective.
All right, very quickly, it's not a death sentence. What are the survival rates if caught early?
Oh, very high, because we start with cures in the 80 to 90% range, but then those who aren't cured by their initial treatment can be managed in the 90s, high 90s.
And last question, an enlarged prostate is not necessarily a sign of
that doesn't
prostate.
increase your risk at all.
Okay, great. Dr. Patrick Bennett, thank you so much.
It's been a pleasure. Dan,
thank you for coming over. We really appreciate it. National Men's Health Month wrapping up in June. Good time to get checked.